Hello, everyone, and welcome. And thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Jesus Cepero, who is the Chief Nursing Officer at Stanford Medicine Children's Health, about his career and his thoughts about trends in the nursing industry. So, hi, Jesus, how are you?
Thank you, G, for inviting me to speak today. Appreciate being
Yeah,
here.
of course. Thanks for being here. So, let's jump right in. How did you begin your journey into nursing?
For healthcare for me has been a calling. Even when I was a teenager, I had always wanted to help people get well. So I joined a volunteer ambulance squad in my town, and I became an emergency medical technician. And I'm working on the ambulance, bringing people to the hospital when they were sick and injured. Really started to engage me in my health career. As I brought patients to the emergency room, I found out what nurses did, and I looked into being a nurse and have now been a nurse for over 40 years and loved every year of it. It's been really a rewarding career for myself. And my wife was also a nurse, by the way, to really help people from illness and injuries to be able to carry on their lives has been my calling. And I tried to do that in my 40 years.
Very cool. It's always so special when you know right away what you want to do with your career. So who have been some of your biggest influences?
Well, my parents were always my influence. They
Mhm.
unfortunately were not healthy.
Mm.
So even as a young child, I was trying to care for them. So they really started to make me feel the need for not only people that are in healthcare, but to also help, family members. And having now been a nurse for so long, I've helped a lot of family and friends through illnesses as well. But I've had many, many coaches and mentors throughout my nursing career, and I really recognize one of my former chief nursing officers at Children's National in Washington, D.C., who really mentored me and told me and helped me get to where I am today. If it wasn't for her support, I probably wouldn't be here today. And also, I've read many, many leadership books, and one of my favorite is John Maxwell. His 21 rules of irrefutable rules of leadership has
Mm.
been one of my guiding principles in my leadership journey in my career. I look at that book every once in a while just to refresh myself and really think about those principles and how I am affecting my team and my organization in their journey to improvement.
Absolutely. So what was your best mistake and what did you learn from it?
Well, I've learned that over my career, the personal interactions, the face-to-face was very, very important to me. And I learned that by taking on a job as a poison information specialist, where I
Mm.
was working on a computer and, poison control, where families and sometimes healthcare providers call to get advice on how to manage a exposure or a toxin or a food poisoning or medication reaction. And that was rewarding work because I was helping people, but it was through a phone. Even during the pandemic, I recognized that not having the face-to-face in-person interactions was something that I really felt was important, especially for healthcare leadership,
Hmm.
being such a personal career, that it was a challenge doing it over the phone. And now even by Zoom, it's still a challenge. So anytime that I could have face-to-face interactions with my staff, with my parents, with my patients, I enjoyed that. So I learned from that experience as to one of my own personal needs was that face-to-face personal interaction.
Absolutely, yeah. So what do you think are some of the biggest challenges currently facing CNOs and CNEs?
Well, healthcare reimbursement is shrinking, especially for
Mhm.
children at women's services, and see in the news about women's health issues. Nationally, they've really become political.
Mhm.
And the reimbursements are becoming even more challenging for chief nursing officers who have large numbers of patients to take care of in hospitals and clinics. it's really become more important now than ever that we use the resources we're given to the best of our ability, because they're not going to be increasing. So they're really providing the best health care for our patients, families, and the community with the given resources has become a bigger and bigger challenge. The biggest second challenge has been to recruit and hire the best of the best healthcare specialists. So,
Hmm.
social workers, care managers, respiratory therapists, surgical technologists, respiratory therapy. There's so many great careers for young people right now that may not be aware, that are, really in desperate needs of people in those roles. So really creating a workforce of the future has been the second biggest challenge for me as a chief nursing officer and my peers.
Absolutely. So I want to ask you a little bit more about that. What are your thoughts on strategies for recruiting and retention that will kind of address, the nursing shortage and other kind of staffing problems that are, you know, happening today?
That is a big challenge as well.
Hmm.
But fortunately, here at Lucille Packard Children's and Women's Hospital, part of the Stanford Medicine Children's Health, we have a very low turnover rate. Our turnover rate is 6.7%, where nationally the turnover rate is up to 17 to 20%. So
Hmm.
our strategies are to really look at recruitment, but not only recruitment of the best, but retaining the staff that we have. As I said
Hmm.
earlier, respiratory therapists, social workers, all those specialties are hard to find right now in the market. So one of our strategies has been to grow our own. We've had a nurse residency program now that's been very successful, 96% success rate of somebody coming into our profession as a new graduate nurse and being
Hmm.
oriented to be able to deliver the care that we need here at Stanford Medicine Children's Health. We take about 120 new grads a year. So that's how we've been able to fill our vacancies. But yet, we're still challenged with some of the subspecialties like social work and respiratory. So we've developed internships and fellowship programs for those specialties to be able to take new graduates out of their programs and give them the skills to be able to take care of our children and women in our hospital. And that's been really successful, but we could still continue to hire more in those specialties. It's always going to be a challenge. It's always going to be our demand is going to be not exceeds the supply out there because there's not a lot of specialists in the market right now that we need to retain and hire.
Absolutely. And I'm curious, do you see a difference in recruiting with this new generation of the nursing workforce that is coming in versus some of the more tenured generations?
There's definitely a generation difference. The new generation coming into the workforce, is not always pleased with having to work weekends or holidays or start on the night shift. And that is just part of nursing. We're a 24/7 hospital that has to provide services to our patients and families in our community. So it is, the work-life balance for the different generations has definitely come into play in the retention of those employees and then trying to figure out the best schedules that we could create to meet their work-life balance needs as well as the needs of the hospital and the organization. So that has been a little bit of a challenge, no doubt.
Absolutely. So, what role do you think diversity, equity, and inclusion plays in improving both the workplace culture and patient care?
It is essential. We want our staff to be as diverse as possible because that's who we're taking care of. And it's really comfortable for a person who is a minority to see other minorities taking care of them. We really value our diversity in our workforce. We have lots of programs to recruit diverse workforce to be able to meet those needs. And we're constantly striving to create an environment for our staff So we have a lot of employee resource groups. We started two, the Black and American uh, resource group and a Hispanic American resource group, so that our community of minority employees feel comfortable in our environment. And that's made a big difference as well. And it's also helped us recruit more diversity in our workforce.
Absolutely. And speaking of feeling comfortable at work, how can CNOs help prevent workplace violence incidents and also support nurses after they occur?
That is one of the biggest challenges right now in all hospitals across the country. Our emergency rooms, our inpatient floors, even in our clinics, we do have an increasing number of workplace violence. We have a very important and strong anti-workplace violence policy. So we take those seriously. We have an education for the parent or for the patient as they're coming into the hospital about our policy and rules about, hostile environment, whether it be physical or verbal harassment or negative comments about
Hmm.
our staff are not tolerated. So once those happen, we actually talk to them again about reinforcing our zero tolerance for workplace violence. And at points, we have asked people to leave the organization. That's not what we want to do. We are healthcare providers. We want to help them get better.
Hmm.
So it is a challenging situation, but it's also very challenging for our physicians and our nurses who are experiencing that violence, whether it be verbal or physical. So we take time to give them a break, especially
Hmm.
after those incidents happen. We refer them to our counselors. We have mental health counselors available for them to speak to. And then last 2 years ago, we started a response team that would go to the unit or the area and deal with the hostile environment of what's happening at that incident so that the staff are not directly involved in that. That
Hmm.
de-escalation team helps a lot
Hmm.
with getting through those difficult situations and has decreased the number of people getting assaulted, which is
That's good.
great,
Yeah.
which is
Yeah.
great. So those are
Absolutely.
the three initiatives we have.
Absolutely. So, I want to circle back just to that well-being piece for a minute. What do you think health systems can do to increase overall nurse well-being and promote a better work-life balance?
Well, one of the new technologies that are coming into the healthcare world is virtual care,
Hmm.
virtual
Hmm.
nursing. And that is really something that we're going to take advantage of and really look at how we could best meet the patient and family needs,
Hmm.
as well as what the nurse can do for them through virtual nursing. So even when they're on an inpatient unit, when they're in the hospital itself, there are ways that we could actually have a virtual nurse that comes on into the room via technology, via TV and a speaker,
Hmm.
and be able to deliver care virtually. That frees up the nurse to be with another patient
Hmm.
and to really do a lot of the documentation that's required for nurses and physicians. So I think the world of virtual care is just beginning in
Hmm.
our environment and in our healthcare world. And I think that's going to be a huge benefit, including for the older, not older, the more senior nurses
Hmm.
that are having difficulties working 3 12-hour shifts on their feet.
Hmm.
There are ways now we can have that virtual nursing job duty via rotation. So everybody can actually do that role and have a little bit of a break between patients, direct patient care. So I do believe there's a lot of opportunities out there that we're just beginning to explore today.
Absolutely. And are there any other technologies that you're excited about that you think will have a big impact on nursing?
Well, we believe that home care nursing has
Mm.
been really shrinking in the past couple of decades. I do believe that the other potential is to care for patients more at home.
Hmm.
Hospitals can't continue to grow. It's so expensive to build new hospitals. So the more we are able to take care of families at home safely is not only great for the family, but it's also great for the organization. But we're going to need specialists to do that, nurses, respiratory therapists, physical therapists. So recruiting that type of workforce, using the technologies available, because there's a lot of home monitoring now that we
Hmm.
could do. So patients could have their blood pressure taken and directly input into the computer. They could have several blood tests that they could just transmit through the computer to their healthcare provider or physician. That
Hmm.
doesn't require them to come to the hospital for a visit or to the clinic for a visit. So I think that technology is also going to be booming and growing in the next decade.
Absolutely. So to pivot back to you personally, what are you most proud of?
Oh, gee, it's been a really great career for me. I'm really most proud of in my roles as chief nursing officer for the last 15 years
Hmm.
to really deliver the high quality excellence in patient care that we've been able to do here at Lucille Packard Children's and Women's Hospital and in my other previous organizations. To me, the most important part of being a healthcare leader is to deliver quite high quality, safe care, and in a way that the patient and family members want. And that's the tough one because
Hmm.
as you know, we could deliver good quality care and be safe, but if it doesn't meet the patient's needs, then it's really not being great, not great experience for the patient. So for
Hmm.
me, holistic care is, really important, and I've been able to implement holistic care in throughout my career because I really do believe when patients come for service, they just don't want their body fixed. They want to
Hmm.
be dealt with in a spiritual way, in a holistic way that meets what their needs are. You could take care of somebody's broken arm, but if you don't understand their pain or their lived
Hmm.
experiences at home and be able to support them at home, then you're really not meeting the patient's complete needs. You're just fixing the broken arm. And that's, to me, my one of my biggest drivers in my career, to create holistic environments that meet patients' needs.
Absolutely. So my last question for you is, do you have any advice for CNOs or CNEs?
This role is not easy, and there
Hmm.
is a lot of turnover in the chief nursing officer roles across the country. Some are retiring and some are leaving healthcare
Hmm.
because of the economic situations and the challenges in delivering health services today. So, really having a strong network of peers to be able to call and support each other is important. To me, I belong to the Children's Hospital Association CNO Forum, which meets twice a year in person. And to me, that really rejuvenates me when I get to be with my peers and hear that my struggles are very much like theirs.
Hmm.
And sometimes they come up with some suggestions or ideas that I hadn't thought of, or sometimes I, give them examples on how we could overcome some of the obstacles in today's healthcare. So to me, our resilience as chief nursing officer is more of a challenge now than ever, and
Hmm.
having a strong collaborative peer group or network that can help support you and help support each other is essential to our success as well.
Absolutely. Well, thank you so much, Jesus, for your time. I'm really grateful to have had this opportunity to get to know you and hear your insights. And thank you so much to our audience for listening.
Gee, thank you for having me today.
Of course. Thank you so much.